under COVID-19 pandemic declarations. This updated policy supersedes the previous medical care policy issued in May of 2020. Provides new information on the eligibility of working costs related to COVID-19 vaccination projects, allowability of certain costs, including billing and fee collection, introduces new requirements for reporting on equitable administration of COVID-19 vaccination efforts, among other updates. We've asked FEMA to answer questions on the updated policy today, and they have kindly agreed. We appreciate FEMA Region 2 working in partnership with us on policy and program matters. I'll leave the presentation today on the policy update, followed by questions from DISHs to FEMA, and then questions from applicants to FEMA. Please use the chat feature in WebEx to submit your questions. We'll get as many of them as possible. This presentation and the question and answer session will be recorded. For any reason anyone has any concerns with that, please sign off on the presentation. We'll post the slide deck and the recording of the presentation on the DISHs Recovery website as soon as possible. A couple of housekeeping items to note, please. Please keep your phones on mute. Please use the chat box to submit questions. A couple quick introductions. Joining me today are Ms. Ann Bink, Deputy Commissioner for Recovery, Ms. Brianna Gonzalez, Deputy Director for Recovery, Mr. Joe Colarafi, Deputy Section Chief for Public Assistance, and Ms. Molly Avancho, the FEMA Region 2 Appeals and Audit Section Chief. March 15th, 2021, FEMA published version 2 of the COVID-19 medical care policy. This policy superseded version 1 of the medical care policy and established new criteria for vaccination administration. The major change is a requirement for all recipients and subrecipients to demonstrate they are addressing proactive measures to provide vaccines to highest risk communities and underserved populations as determined by established measures of social and economic disadvantage, such as the CDC Social Vulnerability Index. We will discuss this further in this presentation. Attached to the interim medical policy was a job aid for the equitable COVID-19 response and recovery recipients and subrecipients. The interim medical care policy applies to primary medical care facilities, temporary and expanded medical facilities, as well as vaccination sites. The interim medical care eligibility policy outlines general eligibility consideration for COVID-19 medical care, such as equitable response and recovery. Notes that all work must be required as a direct result of the COVID-19 pandemic incident. That medical care and associated costs refer to assistance to support the provision of medical care, including eligible facilities, equipment, supplies, staffing, and wraparound services. Section regarding the vaccination sites was added to the medical care policy. The key provisions in the new vaccination section are the equitable response and recovery, data collection and reporting requirements, insurance and billing requirements, on-site infection control measures, i.e. plexiglass barriers, and other measures, resources to support mobile COVID-19 vaccination and/or transportation. The policy outlines the requirements for equitable pandemic response and recovery. As stated in the executive order ensuring an equitable pandemic response and recovery issued on January 21st of this year, 2021, COVID-19 has disproportional impact on communities of color and other underserved populations. In an effort to combat the disproportional impact, FEMA is requiring recipients and subrecipients to prioritize limited resources to ensure an equitable pandemic response. Equity considerations apply to all COVID-19 work. The job aid provides the steps recipients and subrecipients must take to document that the pandemic response and recovery efforts are conducted in an equitable manner to communities of color and other underserved populations. FEMA will monitor compliance with this grant condition in concert with federal regulation and law. As a condition of receiving public assistance funding for the COVID-19 declaration, Recipients and subrecipients must focus the use of FEMA funding on the highest risk communities and underserved populations. The equity consideration requirements are retroactive to January 20th, 2020. Specific to the interim medical care policy is a section regarding equitable pandemic response and recovery. As a condition of receiving public assistance, recipients and subrecipients must focus the use of FEMA funding on the highest risk communities and underserved populations as determined by established measures of social and economic disadvantage, e.g. the CDC Social Vulnerability Index. Recipients and subrecipients must prioritize limited resources to ensure an equitable pandemic response. Failure to adhere to this policy could result in funding reductions and/or delays. Consistent with medical care policy issued in May of 2020, all work must be directly related to the treatment of COVID-19 patients. This includes both emergency and inpatient clinical care for COVID-19 patients, both confirmed and suspected cases of COVID-19. Emergency and inpatient clinical care for COVID-19 patients includes emergency medical transport related to COVID-19, triage of medically necessary tests and diagnosis related to COVID-19 patients, necessary medical treatment of COVID-19 patients, as well as prescription costs related to COVID-19 treatment. Please note, medical care related to the treatment of a non-COVID-19 illness or injury in a primary medical care facility is not eligible for reimbursement through public assistance. The following medical care activities and associated costs are eligible at primary medical care facilities: purchase, lease, and delivery of specialized medical equipment necessary to respond to COVID-19. Note that equipment purchases are subject to disposition requirements. The purchase and delivery of PPE, durable medical equipment, and consumable medical supplies necessary to respond to COVID-19, including the costs of eligible state, local, tribal, and territorial government applicants providing PPE to any public or private medical care facility that treats COVID-19 patients. Keep in mind that face masks and cloth face coverings are not PPE. Also, medical waste disposal related to COVID-19. Certain labor costs associated with medical staff providing treatment to COVID-19 patients may be eligible as outlined below. Any labor costs for medical staff that are included in patient billing and/or otherwise covered by another funding source are not eligible for public assistance. Otherwise, the following labor costs may be eligible: overtime for budgeted medical staff providing treatment to COVID-19 patients, as well as straight time and overtime for temporary medical staff providing treatment to COVID-19 patients. Straight time, overtime, and other necessary costs for contract medical staff providing treatment to COVID-19 patients. Work and associated costs must be consistent with the scope of the contract and may include costs for travel, lodging, and per diem contract medical staff from outside the local community area. Increased operating costs for administrative activities, such as medical billing, are not eligible. Now we turn to temporary and expanded medical facilities. FEMA may approve work and costs associated with temporary medical facilities or expanded medical facilities when necessary in response to the COVID-19 public health emergency. These facilities may be used to treat COVID-19 patients, non-COVID-19 patients, or both as necessary. Medical care activities and associated costs related to treating both COVID-19 and non-COVID-19 patients in a temporary or expanded medical facility may be eligible. This also may include alternate care sites or community-based testing sites if eligible work and costs are incurred by eligible public assistance applicants. Costs must be reasonable and necessary based on the actual projected needs. The projected needs, i.e. the capacity and capability for a temporary or expanded medical facility, must be supported by predictive modeling or other substantiating information used to determine the projected needs. Contract costs related to establishing and/or operating a temporary or expanded medical facility must include a termination for convenience clause that will be implemented if the site is ultimately not needed, or the needs are less than projected as determined by the legally responsible entity. Ongoing and projected needs regarding continuing operations at a temporary or expanded medical facility should be based on regular assessments, and the applicant must document the review process to support its decision-making. The assessment should include adjustments to projected needs based on guidance from public health officials, caseload trends, and/or other predictive modeling or methodologies, lead times and associated costs for scaling up or down based on projected needs, and any other supporting information. The assessments and supporting information are necessary to determine eligibility of claim costs and should align with reasonable cost guidance provided in the FEMA Program Public Assistance Program Policy Guide and the FEMA Public Assistance Reasonable Cost Evaluation Job Aid, which is available on the DISH's website. Eligible costs for temporary and expanded medical facilities include all eligible items and stipulations included in primary medical care facility policy, but applicable to both COVID-19 and non-COVID-19 patients. The lease, purchase, or construction costs as reasonable and necessary for a temporary facility, as well as reasonable alterations to a facility necessary to provide medical care services. Mobilization and demobilization costs associated with setting up and closing the temporary or expanded medical facility. Operating costs including equipment, supplies, staffing, wraparound services, and clinical care not covered by another funding source, and maintenance of a temporary or expanded medical facility in an operationally ready but unused status available for surge capacity for COVID-19 when necessary to eliminate or lessen an immediate threat to public health and safety based on public health guidance, location of areas expected to be impacted, and local and state hospital bed ICU capacity. Vaccinations. The work and associated costs to support the distribution and administration of COVID-19 vaccines may be eligible for public assistance. The federal government continues to provide the vaccine itself at cost. Version 2 of the FEMA Public Assistance Medical Care Policy added a new section on eligible working costs for COVID-19 vaccinations. The updated medical care policy provides detailed information on eligible public assistance work and costs to support the distribution and administration of the vaccine. Such costs may be eligible for public assistance funding when they are necessary to effectively distribute and administer COVID-19 vaccines consistent with established vaccine protocols, CDC and/or other applicable public health guidance, and public assistance program requirements. Eligible working costs under PA include community vaccination centers, PPE, other equipment and supplies required for storing, handling, distributing, transporting, and administering COVID-19 vaccinations, PPE includes items necessary for proper handling and administration of vaccinations, as well as handling dry ice for storage and transportation. Equipment includes coolers, freezers, temperature monitoring devices, and portable vaccine storage units for transportation. Supplies include emergency medical supplies for emergency medical care needs that may arise in administration of the vaccine, sharps containers for medical waste, and supplies necessary for proper storage like dry ice, and transportation support such as refrigerated trucks, transport security when reasonable and necessary. Eligible vaccination work and costs under PA also include facility support costs, including leasing space for storage and/or administration of vaccines, utilities, maintenance, and security. Additional staff, if necessary, including medical and support staff not paid for by another funding source and consistent with FEMA Public Assistance labor policy. On-site infection control measures and emergency medical care for COVID-19 vaccination administration sites are also eligible for public assistance, including masks, cloth facial coverings for patients, masks and cloth facial coverings for patients, disinfection of facility and equipment in accordance with CDC guidance, temperature scanning, including purchase and distribution of handheld temperature measuring devices and associated supplies, acquisition and installation of portable temporary physical barriers such as plexiglass barriers and medical screens and dividers, medical waste disposal related to vaccinations, and on-site emergency medical care to address adverse reactions to vaccinations or other emergency medical care needs that may arise while administering COVID-19 vaccination. Also eligible for public assistance vaccination reimbursement are resources to support mobile COVID-19 vaccination in remote areas and/or transportation support for individuals with limited mobility or lack of access to transportation when reasonable and necessary. Equipment and supplies necessary for proper storage, handling, and transport in accordance with CDC guidance, support mobile vaccination units, medical and support staff for mobile vaccination units in accordance with PA labor policies and this policy, and transportation to and from vaccination sites for individuals with limited mobility. Limited mobility includes individuals with disabilities that require transportation assistance and individuals that are otherwise unable to get to and from vaccination sites without transportation assistance. Eligible work and costs for COVID-19 vaccinations continue. Federally qualified health centers. Vaccine-related costs incurred by a federally qualified health center. Rural health clinics and critical access hospitals that are not covered by HHS or another funding source. Federally qualified health centers fall under the authority of the United States Department of Health and Human Services. PA funding can be provided for eligible costs that are not covered under this authority or another source of funding. Communications to disseminate public information regarding vaccinations, including translation and interpretation services, are also eligible costs as necessary. This may also include work and costs associated with setting up and operating a call center or website when reasonable and necessary for the purpose of sharing vaccination information with the public and/or to support the implementation and management of COVID-19 vaccination plans. Information technology, equipment, and systems when reasonable and necessary for patient registration and tracking, vaccine-related inventory management, and/or analytics and reporting needs. To the extent possible, vaccination providers should utilize existing IT systems and processes for managing the distribution and administration of COVID-19 vaccines. The CDC also developed the Vaccine Administration Management System, or VAMS, for jurisdictions and healthcare providers that do not have existing IT systems for vaccination management. In the event existing IT systems and VAMS are both inadequate to meet the needs of vaccination providers, IT equipment and systems necessary for the distribution and administration of COVID-19 vaccines are eligible for public assistance. The systems should collect demographic data required under the Stafford Act and consistent with guidance from Fema. The system must be able to report data to Fema when requested. Also, training and technical assistance specific to the proper storage, handling, distribution, and administration of COVID-19 vaccinations in accordance with CDC guidance is also eligible for public assistance. FEMA has added requirements for recipients and applicants to demonstrate that vaccination administration is consistent with equitable pandemic response and recovery. Recipients and applicants must collect data on race, ethnicity, and disability status. Recipients must also make best efforts to collect additional anonymized, equity-focused person-level data, including information on primary language and sexual orientation or gender identity. Recipients and subrecipients must incorporate these data in their development of short-term targets for the equitable deployment of FEMA financial assistance and identify data sources, proxies, or indices, including demographic data disaggregated to reveal socioeconomic, racial, linguistic, age, gender, disability, and other indices that will enable recipients to develop short-term targets for equitable delivery of FEMA-funded assistance and to reach communities of color and other underserved populations. Recipients and subrecipients must submit to FEMA information documenting the following for sites selected for vaccination administration every 30 days. For each site, provide a score on the CDC's Social Vulnerability Index or a similar social deprivation, disadvantage, or vulnerability composite index. A description of how the location or the site, relative to other candidate locations, best advances FEMA's focus on supporting the highest risk communities. This justification may also include a comparison of vaccination rates for demographic groups by geographic area. Site strategy to operationalize equitable access, including but not limited to a plan for community outreach and engagement both before and during implementation, a registration process that advances equity with a focus on prioritizing minoritized, marginalized, and otherwise disadvantaged groups, equitable physical design of the site, including transportation and accessibility considerations, and a plan for ongoing evaluation and continuous improvement to ensure equitable access. Group 1 recipients or subrecipients that completed all of their vaccination work and that FEMA has obligated funding must submit the information within 30 days of the issuance of the medical care policy due April 14th, 2021. Have applied for, but FEMA has not yet obligated funding, must submit their information within 30 days of the vaccine-related obligation. They have not yet applied for FEMA funding, they must submit the information with their initial request for FEMA vaccination funding. FEMA reviews these submissions once for completeness and compliance. FEMA may request additional information as necessary. Group 2, these are recipients and subrecipients that have not yet completed all their vaccination work and where FEMA has obligated funding, they must submit the information within 30 days of the issuance of the medical care policy, which is due April 14th, 2021. They have applied for, but FEMA has not yet obligated funding, they must submit the information within 30 days of the initial vaccine-related obligation. They have not yet applied for FEMA funding, they must submit the information within 30 days of the initial vaccine-related obligation. This group must submit ongoing updates for every 30 days until the completeness of vaccination work. FEMA will review submissions monthly for completeness and quarterly for compliance. General eligibility considerations. Costs must be necessary and reasonable in order to respond to the COVID-19 pandemic. Costs should conform to standard public assistance program eligibility and other federal requirements. Applicants should follow their established practices and policies and procedures that apply when federal funding is not available, including standard billing and fee collection. FEMA does not require applicants to create a new billing process at temporary medical facilities. All work conducted and costs incurred in primary medical care facilities should follow the facility's standard billing practice. If a primary medical care facility did not follow its standard billing practice, the applicant must demonstrate why following such practices would have increased an immediate threat to life and demonstrate that all costs not reimbursed by FEMA followed the same procedures. FEMA will scrutinize the applicant's documentation of compliance with federal laws and other public assistance requirements, adherence to procurement requirements, including reasonableness of cost and how the item was secured if applicable, invoices and proof of payment if applicable, shipping information if applicable, asset distribution of all locations, i.e. staging areas, stockpiles, and storage, and usage in the performance of eligible work. Rule of thumb here is document, document, document. In accordance with the February 17, 2021 memorandum from the Fema Recovery Assistant Administrator titled 100% Federal Cost Share for COVID-19 Public Assistance Funding, FEMA will increase the federal cost share for all COVID-19 declarations from 75% to 100% for eligible work performed or to be performed from January 20th, 2020 through September 30th, 2021. Regarding duplication of benefits, please note that FEMA cannot duplicate assistance provided by HHS or other federal departments and agencies. A list of funding that may be considered duplicative is provided in version 2 of the interim policy for medical care. Federal and state funds received to combat the virus will have to be deducted from any eligible project if used for any portion of that project. Okay, well, thank you for listening to that presentation. We will now move on to our question and answer section of this presentation today.
Good afternoon, everyone. Molly, can you unmute yourself when you have a chance so we can make sure your audio works?
Hello, hello, testing.
We hear you, Molly. Thank you for joining today. We really appreciate it. We know your time is precious, especially nowadays with everything going on with the various disasters. So the first question we have is for you, Molly, is for vaccine distribution sites, are straight time labor force accounts costs eligible if the staff were reassigned from other responsibilities?
Staff reassigned from other responsibilities. So you hit me with a question that I refuse to answer without looking at the PA program and policy guide, because I simply cannot, but it'll take me just 2 seconds. I just cannot commit all of our labor policies to memory with everything that we have. So I believe reassigned employees, they're still full-time employees, so there's no additional cost above and beyond what's budgeted. So I don't see the difference between a reassigned employee and everyone else. If it's a budgeted employee, yeah, I don't see they're telling enough from external. So yeah, there's no difference between a reassigned employee and a regular employee with respect to the regular time and overtime. So no, regular time would not be eligible.
Okay, thank you for that, Molly. Another question is, for vaccination sites, is regular time force account labor an eligible cost when the staff are reassigned to work the vaccine clinic?
Again, if it's the applicant's permanent full-time staff that are budgeted, and the applicant is setting up vaccination site, no straight time.
Okay. So Molly, if a temporary staff was hired to backfill the reassigned employee, would that cost for that temporary hire be eligible?
Temporary hires, I believe so, as long as the backfill is hired to replace an employee who's fully doing eligible work under COVID, and in this instance, that would be the case. So if an employee is reassigned to work a vaccination site and then the applicant hires a temporary backfill, then yes, the backfill cost would be eligible. But again, it would be overtime only, I think.
Thank you, Molly.
You're
So
welcome.
another
Yeah.
question is, does this policy apply to the county health department testing/vaccination clinic that can perform 1,000 a day?
Yes.
Okay. So another question we have is, does the Equitable Pandemic Response and Recovery only apply to the vaccination sites?
No, it applies to everything with respect to category B, all COVID work. It's just at this point in time, we don't have all of the details from headquarters on exactly how we're going to implement the requirements. Right now, all we have are specifics related to data collection that we need related to vaccination sites.
Thank you, Molly. You started to answer the next question, but just for the audience, so everyone knows, the next question was, if these equity pandemic response and recoveries apply to all FEMA Category B funding in TR 4480, when will more guidance be provided and released? And it sounds like we're waiting on that, correct, Molly?
Yes. Everyone is working hard at headquarters to get additional guidance for us.
Thank you, Molly. Next question. What is FEMA referring to in regard to limited resources that must be prioritized? Are these PA resources or other federal funding?
That's another good question. I'm going to hold on answering that question because I have my opinion on what it means, but it's really not, it's not clear yet. Again, additional information, hopefully we're waiting for more information from headquarters. Hopefully it'll get cleared up.
Thank you, Molly. The next question is, how will failure to adhere to this requirement be assessed? And it sounds like you guys are still waiting for more guidance in Region 2 to see how that would actually be assessed. Is that correct?
Oh, I'm sorry. I just got distracted by a note from Joe, and he's absolutely right. If I misspoke, if I was talking about a temporary employee that was hired, both regular and overtime would be eligible for that temporary employee was hired. Sorry, that was a couple questions ago, but yeah.
Okay, so we'll go back to that. What you're saying is that if a temporary staff member is hired to backfill for an employee who has been deployed to the vaccination site, that temporary backfill salary, straight time and overtime are both eligible for reimbursement. Is that correct?
Hold on.
If you want to say it differently, go
Yes.
ahead.
Yeah, you're hitting me with all of these labor questions, and they aren't my favorite. But
And Molly,
yeah,
this is Joe. This is Joe Colarafi. That answer is correct. If a temporary employee is hired to backfill a budgeted employee who is detailed to do COVID work, the salary, both straight time and overtime for the temporary, is eligible while that permanent employee is working on COVID.
okay. So I'm going to have to I just can't answer the question. I can't confirm it. I know that temporary employees hired to do eligible work, their straight time and overtime are eligible. I'm just not super comfortable answering that specific question. So if you wouldn't mind I mean, you could certainly take Joe's word for it, of course. But I would, I'll just go back and look at our labor policies just to double and triple check. And
Thank you,
I'll
Molly.
shoot you an email.
Thank you. And then for individuals on the line who are listening, we'll make sure we get that updated FAQ and add that to that online. So please be sure to check our DISH's website. Okay, Molly, thank you. The next question is, how will FEMA calculate a possible funding reduction or funding delay if we do not attest to the pandemic equitable response?
That's also another very good question, and another one that I cannot answer yet. More that headquarters is working through. More kind of the nuances of exactly how we're going to be informed, how to implement any kind of remedies for noncompliance. That's definitely under discussion right now at headquarters. And as soon as we receive the information, we'll be able to share it with you all.
Great, thank you, Molly. Now, this is a multi-part question that's coming in, so I'm going to do piecemeal for you, Molly, so it doesn't get lost. It's a little long. Is this medical interim policy retroactive to January 20th of 2020 or starting the day it was published?
It is retroactive to 20 to the beginning of the yes.
Thank you, Molly. And then the follow-up was, if this is retroactive, how do we give the reporting to FEMA and show that we were funding the highest risk communities and underserved populations when this is a new requirement a year later?
Yeah, that's another good question. I'm not exactly sure. So what we know for sure now is that we need specific information to be submitted related to vaccination sites only. So as of now, we don't have any specific requirements to support the equitable, I guess, the use of funding and resources for all Cat B work right now. I don't know if we're going to be told that we have to go back and gather information for work that's already been completed. I know for a fact we have to do that for vaccination sites that may have opened and are already closed. We do need that information. Again, the only documentation requirements, submittal requirements that we're aware of to date have to do with vaccination sites. So I'm not exactly sure how it's going to play out for everything else.
Thank you, Molly. Next question. For skilled nursing facilities, what expenses are eligible for items used to prevent the spread of coronavirus among residents and staff who are not COVID positive? Is PPE included? Face mask, sanitation supplies, all prior to 9/15 of 2020? I'm not sure why the designation of September 15th, but.
Can you, I'm sorry, can you repeat the question? I missed the very beginning.
Absolutely. For skilled nursing facilities, what expenses are eligible for items used to prevent the spread of coronavirus among residents and staff who are not COVID positive? Does this include PPE, mask, sanitation supplies prior to 9/15 of 2020?
The reason why I'm hesitating on this is the use of, you're saying skilled nursing facilities. I'm not exactly sure what a skilled nursing facility is, to be honest with you. And, you know, our policy is written in terms of medical care facilities, and different things are eligible for medical care facilities than for other facilities. So, you know, with respect to a medical care, a facility that provides medical care as defined in our policies, then yes, all of the, necessary protection and sanitizing the facility would be eligible. There's a question with respect to what PPE might be required for what employee. Maybe an administrative employee doesn't need the same level of protection that a nurse working directly with patients would need.
Thank you, Molly. The next question is in regard to eligibility of vaccination planning. Is testing for COVID-19 an eligible activity at a vaccination planning site?
Testing for, I
I'm
don't think,
thinking they're
actually-
asking about the volunteers and employees of the vaccination site, if that is.
Yeah, I'm not aware of any additional eligibility for testing at vaccination sites other than what's already in the medical care policy. So if there, if for some reason at the vaccination site, they set up at the same time a community-based testing site in that same location, then people can get tested at a community-based testing site. Otherwise, if you're, you would have to go to a medical care facility to obtain a test, and it would have to be, according to the policy, medically necessary. And I'm just not sure how folks are, I guess to go back to when I first tried to get tested, when I was exposed to COVID, I had a hard time getting a test because I had no symptoms. There were some places that would test you if you were exposed, and other places who wouldn't, other places that wouldn't. So whatever the requirements are to get a COVID test in a medical care facility, if a medical care facility tests you, then that applicant would be eligible, subject to all other eligibility criteria with respect to costs and duplication of funding for providing that testing. There's nothing listed in the medical care policy that specifically says that setting up testing at a vaccination site is eligible. So I don't know exactly if I'm answering your question, but testing, is eligible if you're an applicant that runs a medical care facility.
So to recap, Molly, it sounds like
I'm kind of babbling here. Sorry.
If you're running,
thinking through it. Good.
If one of our applicants is running a vaccination site only, testing of volunteers of employees who are assigned or volunteering at that vaccination site, it would not be reimbursable for their testing of COVID. However, if there was a testing site across the street and they sent their volunteers and employees across the street to get tested for COVID, that could be reimbursed because there is a testing site. Is that correct?
Yes. And even if it's co-located, if it's a community testing site. Yeah.
Okay, so even if it's on the same side of the street.
Yeah.
So now we have some questions about reporting. For the newly required reporting associated with the vaccination sites, when does the 30-day clock start?
So if you've already had funds obligated, approved by FEMA for setting up or, running a vaccination site, the 30-day clock starts the date that the policy came out. So I believe they're saying 30 days is April 14th. April 14th, 2021. So for any applicant that already has funds obligated, approved by FEMA, the deadline is that April 14th. If you have a project that's in the system that has not been obligated yet, the 30 days start as of the date of obligation. The only exception to the tie to obligation is if you've already completed your vaccination work. If an applicant has opened and then closed a vaccination site and has not yet come to FEMA for funding, with its funding request, it would have to be that the documentation would have to be provided with the request for a project, and it would be reviewed in conjunction with processing of the project. But otherwise, it's either 30 days if it's already funded, 30 days from the date that the policy was released, and if it hasn't been obligated, it's 30 days from the date of obligation.
Thank you, Molly. Now we get into billing and insurance. How will the requirement to bill insurance be enforced in settings where the state has worked with the provider to set up a vaccination staff in a facility that normally bills insurance?
Yeah, that's a question that I struggle with a lot, and I'm still not comfortable with answering any questions related to like that. Just other than just parroting the language from the policy, unfortunately, which says that we don't require applicants to set up new billing processes. And I know that's not answering your question. It's just I haven't been able to wrap my head around that myself yet. So,
Okay.
And I've asked headquarters and I haven't gotten a good answer yet. So we'll keep working on that one.
Thank you, Molly. This is in conjunction with the prior question, so I understand if you're not able to answer it at that time because we're waiting for more guidance. But the question is, since some of our vaccination sites have been in operation prior to the release of the policy, going as far back as December, how are we to capture insurance at this time if we did not capture it back in December because of operational reasons?
Well, I guess, the insurance requirement has always existed. So I guess I don't know, you can't necessarily, if you can't go back and collect for some reason, we would ask for justification for why you operated a certain way, why you weren't collecting insurance information and submitting insurance billing. So it's kind of hard for me to answer that question without all of the specifics of that case. So, if there is an applicant out there who has this particular situation, and it's ongoing right now, and you're struggling with what to do and what the requirements are, I recommend that you work through the operational staff, FEMA's operational staff, to give very specific information so that we can work through that scenario to get you a good answer.
Okay, thank you, Molly. Now we have a question regarding equity. Can we use the CDC SVI index from 2018 as our SVI number for social vulnerability reporting?
Is there a reason why? So again, this is not my area of expertise. Is there a reason why you would when it's 2021? I mean, I would think you would want to use the most current data. So I maybe I'm confused by the question, but I don't see how 2018 data would apply for today.
I have nothing else to add to that question, Molly. So,
Okay. Sorry.
oh, apologies. The
Mhm.
individual did add more information. The individual state said they believe the 2018 data is actually the last published CDC calculated SVI. So it appears that that is the latest data that has been provided on the website. And I have other individuals coming in saying the same thing, that 2018 is the latest data available.
Okay, well, if that's what's available, then, you know what, I'm going to write this one down also to follow up with people who are more familiar with that data, just to confirm.
Great, thank you, Molly. Around contracts, do all contracts require a termination for convenience clause, or does that only pertain to the temporary / expanded medical facilities?
It's for this particular scenario. I have to be careful when people talk and use the word always. With respect to our medical care, that requirement is specific to contracting for support at a temporary or expanded facility.
Okay, thank you, Molly. Jumping back to the due date for the vaccination site data submission, someone wants to clarify, do the 30 days begin after we submit and that vaccination application is obligated, or is it April 14th?
If you do not currently have funding obligated, then the 30 days starts from the date of obligation. If you already have funding obligated, the 30 days starts from, or the deadline is April 14th.
Thank you, Molly. So essentially, if they have a project that has already been obligated and work is underway or work has been completed, April 14th is when they should be submitting their first data submission.
Yes.
But I encourage others to go to the job aid where the groups are written out if you need more information on that, because we're getting a lot of questions about that in the queue, Molly.
Okay.
So next question, when applicants have limited doses of the vaccine and directives from the state, local, and federal have been focused on administering the vaccines quickly, how do we now advise applicants to weigh the need for administering vaccines quickly and evaluating the equitable administration of such vaccines?
All I can say is it's a requirement, so it just has to be done. So I understand there's a lot of challenges. I understand there's other, other considerations to be made, especially when, you're focusing on folks, at least in the beginning, when, it was limited to people within certain eligibility groups, the different phases for vaccination. But all I can say is that the information policy, if there's a vaccination site that was set up, remember, this is not required for, say, vaccinations that were provided to a hospital. This is the data required that we're talking about that's specifically spelled out currently in the policy and in the job aid. That is for vaccination sites that were set up. So, temporary vaccination sites, community-based vaccination sites. So the information is laid out there as to what you need to provide. And if there's anything, what I recommend is if there's anything that you, in putting together your documentation, you feel as though you're missing the mark, or you missed the mark with respect to some kind of equitable distribution or administration requirement, The part of the information that's requested is can't remember. I think they call it an improvement plan for your program. I would certainly address that in that section of your submittal, and to, show that, while you may have in the past not been doing A, B, C, or D, this is why, and now to correct that situation, you're going to do these things. Hopefully that answers that question.
Thank you, Molly. To recap, it sounds like when applicants are submitting their response, they can state what they have done thus far in recognition of other restrictions, but establish a plan moving forward to meet the equity requirements.
Yes.
Thank you. Another question around the application for vaccination efforts. If we have not submitted an application for our vaccination efforts, just to clarify, do the 30 days begin after we submit that vaccination application? Or is it once the application and project is obligated? Or is it April 14th?
Okay, so if you haven't even submitted a request for a project yet, if your vaccination effort has been completed, say you opened a site in the beginning of the vaccination effort and you've now closed that site, then the documentation requirements, they're required as part of your project submittal. You have to submit that documentation with your project submittal, or if you don't, we'd go back to you and say, hey, we can't process this project without this documentation. So you have to provide the documentation. If your vaccination site is still in operation, then your 30-day deadline does not start until the project is obligated. Doesn't mean you can't go ahead and submit the information before it's obligated, but the deadline starts from the date of obligation.
So with that being said, Molly, is it safe to say it's that obligation that triggers the 30-day reporting?
As long as the vaccination effort is still ongoing, yes.
Thank you, Molly. Next question is similar strand. Does the April 14th date only apply to vaccine applicants or also other COVID-related applicants, such as PPE?
The April 14th deadline is only about submitting the very specific information that was requested in and set out in the policy and the job aid, which is specific to vaccination sites only at this time.
Thank you, Molly. Next question is around equitable vaccine administration information. To confirm, the required equitable vaccine administration information is only requested for specific sites set up for vaccine distribution and not for hospitals providing vaccinations at their existing hospital/physician practice sites.
Yes, that is correct. I'm not saying, don't hold me to it if later on headquarters says, okay, now we need this information from all the hospitals. There may be something that comes out later where we may have to get information for the hospitals. But right now, the data that we know that we need is for vaccination sites that were set up, not existing hospitals. Now, if a hospital, right, is the hospital is an applicant, and if that hospital sets up a vaccination site, then they would have a requirement to submit this information.
Okay, thank you, Molly. So the distinction there is vaccination site versus permanent hospital site, or is it permanent hospital dwelling versus temporary hospital dwelling versus a vaccination only site?
It's the requirement is for vaccination sites that are set up. So they're specific to vaccination sites that are set up. So if a temporary medical care facility that's providing all sorts of things, and it's not a specific vaccination site, then that would not fall, that's not, this data wouldn't be required at this time. Currently, the only requirement for this data is it's very specific to vaccination sites.
Thank you, Molly. Next question, and going with the vaccine pod theme. Are meals provided to employees working at the vaccine pods eligible for PA FEMA reimbursement?
My assumption will be no. That being said, there are some exceptions to that laid out in our policy, and I should look at it and not speak off the top of my head, but I think it's, if meals aren't available, or if there's something in there in the labor policies that require the applicant to provide meals to their employees. I'm trying to quickly look up, let's see, meals. Okay. So the only time we would pay for meals, if they're required based on a labor policy or written agreement, if the conditions constitute a level of severity that requires employees to work abnormal extended work hours without a reasonable amount of time to provide for their own meals, or if food or water is not reasonably available for employees to purchase. And so if the situation is that, if it meets the second situation I just laid out, that employees are working abnormal extended work hours without a reasonable amount of time to provide for their own meals, in that case, FEMA would only reimburse the cost of meals that are brought to the work location and purchased in a cost-effective and reasonable manner, such as bulk meals. FEMA does not reimburse costs related to group outings at restaurants or individual meals.
Thank you, Molly.
Mm-hmm.
The next question is going back to reimbursement for employees' time. If an employee is paid more at the vaccine clinic than in their normal position, is that differential above their normal pay rate eligible for PA reimbursement?
That's also a difficult question to answer when you're talking in hypotheticals. When FEMA is looking at eligibility of labor costs, we always go back to the applicant's pre-disaster written labor policy to determine whether the costs that are requested are eligible. So we would have to look at the pre-disaster written labor policy and see if those costs would be eligible.
Thank you, Molly. And going back to the equitable response and recovery, do these requirements apply to all Category B work, and reporting only applies to vaccination sites?
As of today, the answer is yes. I do not know if we will have reporting requirements for other Cat B work. I just don't know yet.
Thank you. Going back to staffing and vaccination sites, to recap, my understanding is that a county sheriff deputy assigned to a vaccination pod is eligible for reimbursement if he is there on overtime, but not on straight time, since he is a budgeted employee. Is this correct?
Yes.
Thank you, Molly. Next question. At what point should we be obligating our vaccination project?
Well, if, you know, it's FEMA that does the obligation. But if you if you're operating a vaccination site now, and you haven't submitted a project, I would recommend you get started on the process now. You know, if you're incurring costs that are eligible for reimbursement, by all means, start the process to get reimbursed.
So we have a request, it's more of a request than a question. Please repeat the piece about hospital sites for vaccines. I'm guessing the questioner is referring to the reporting for hospital sites. So Maggie, if this is wrong, please correct me through the Q&A box, but I think what the person is asking, Molly, is are there reporting requirements for the equity data for hospital sites distributing vaccinations?
Okay, so as of today, if a hospital is providing, you know, vaccines within its primary facility, within the existing hospital, there are no reporting requirements related to equity as of today. However, if a hospital decides to set up a vaccination site, a temporary vaccination site outside of its normal, you know, primary facility, then that would be considered something that would trigger this reporting requirement.
Thank you, Molly. Now, the next question in that sort of string of thought is, what about physicians' practices that are administering the vaccinations? Do they have to do the reporting associated with equity?
As of today, no. And as a matter of fact, I don't know that FEMA would likely never get involved in that anyway, because we're only talking about eligible applicants. And, you know, a physician itself, a physician's office, a medical practice, you know, I mean, we're talking about private nonprofits and local and state, territory, tribal governments. So whether or not the federal government puts some requirement on them at some point, that is, I don't know.
Okay, and that would, just for my clarification, Molly, that would also apply to some of the like CVS's, Walgreens, and whatnot. It's outside of PA, therefore not needing to be addressed in this policy.
Right.
Thank you. Next question. It's not clear to me a vaccination clinic run by a hospital is not eligible unless the hospital is a critical access hospital, correct? I can't, did you get anything out of that, Molly? I'm not sure I understood that.
Well, okay, so if the hospital is an eligible applicant and they set up a vaccination clinic within their hospital, then, you know, costs to administer the vaccine could be eligible as long as they meet all the other requirements. Meaning, you know, we're talking about staff overtime, and we're talking about costs that are not covered by insurance. If there's any additional work that they have to do to establish or set up the clinic within their hospital space, that could be eligible. And if, you know, the hospital sets up its own kind of temporary vaccination site and they're an eligible applicant, then those costs could be eligible as well.
Thank you, Molly. Next question. If an applicant was going to lay off their employee in another department, it's decided to move them to help out with COVID-19 in another department, would the regular time be eligible?
I must admit, I just got distracted by a text. Sorry, could you read the question again?
Absolutely. If an applicant was going to be laid off by their employer, or if an applicant was going to be laid off their employee in another department, but decided to move that employee to another department to help with the COVID-19 response, is their regular time eligible?
The layoff would have to have already happened. If the individual was never laid off or never furloughed, then that individual is still a permanent employee of the applicant. So, however, if the individual was furloughed or laid off and then called back, in that situation, their time would be eligible.
Thank you, Molly. Another question.
Kind of like a temporary employee.
Okay. The next question is in regard to a change in the policy. It appears that the following sentence was deleted from the medical policy, and in quotes, the projected needs for a temporary or expanded medical facility must be supported by the predictive modeling or other substantiating information used to determine the project need. The question is, can recipients and subrecipients now interpret this change to mean that predictive modeling or other information is now only applicable to contract costs for establishing the temporary facilities?
No, there's still a need. You still need to, if there is a temporary site that's set up, there are costs that are being claimed. There is still a need to justify those costs and to support the eligibility of those costs. So I'm just pulling up the policy to see if I can find some language here. So it's a little less extensive, the language, but the policy does still say that for temporary and expanded medical facilities, costs must be reasonable and necessary based on the actual or projected need. So there's still, you still have to provide something to show that there is a need for it.
Thank you, Molly. For those of you on the line, if you have questions, send them in. I am down to my last three. So Molly, this is in regards to Medicare rates. Fema states in the policy, it will use Medicare rates as the basis to determine reasonable cost for eligible clinical care not covered by another funding source. For those clinical care costs not covered by another funding source, how will FEMA compare Medicare rates to complex costs, including in-house and contractor of delivering COVID-19 clinical care?
That's a question that I've actually had since the initial medical care policy came out. So, and I still don't know the answer to that question. I think it's one of those situations that we're just going to have to deal with case by case and look at each project and see if there's a need to go to the Medicare rates. And at that point in time, knowing exactly what we're looking at, we'd be able to address the specifics of the project and the costs.
Okay, Molly. And then just the follow-up that came to that was Medicaid reimburses approximately $40 per COVID-19 vaccine dose administered. However, that reimbursement is only for the cost of administering the vaccine. It does not include other costs such as direct clinical staff time or indirect staff training. Will we be able to charge those wraparound services to PA?
As long as the costs are not covered by another source and they're reasonable and necessary, and meet other eligibility requirements. If it's associated with vaccine administration or distribution, then they get reimbursed.
Thank you, Molly. The next question from that same sender was, for clinical care covered by another funding source, is it correct that FEMA will fund the cost above what is covered by that other funding source?
Can you repeat that?
Absolutely, that was a tongue twister.
Yeah.
Clinical care covered by another funding source, is it correct that FEMA will fund the cost above what that funding source covered? So it sounds like if a cost of a service, a medical service was $100, and they're able to recoup $40 from one funding source, would FEMA be willing to cover the $60, of course, if it's reasonable and appropriate?
Right. Yeah, as long as it meets all of our other eligibility criteria, you know, of course, you've got to, the work has to be eligible, costs have to be reasonable, but yes.
Couple more have come in. So this is a clarification to that employee who was going to be released and then moved to another unit to help with COVID response, Molly, just to give you some context there. So the ask is, just for clarification, if an applicant furloughed a budgeted employee and then brought them back specifically for eligible COVID work, would straight time and overtime of that employee now be eligible?
Straight time, furloughed, yes. That is true. Yes, straight time and overtime.
Great, thank you. So the next question is, will FEMA release a policy on providing occupational COVID testing for staff of medical facilities when it was required by a government agency? For example, in New York State, all nursing home staff must be tested 2 times per week. Commercial insurancers have announced they will not pay because the tests were not medically necessary.
I can't predict what types of policies FEMA will put out. However, what I do know is that FEMA is going to put out a policy on opening and operating facilities, and it supposedly is going to be coming out very soon. And that issue might be addressed in that policy.
Thank you, Molly. A question regarding mobile vaccines. For mobile vaccines distribution to homebound patients, is the mileage eligible for the employee if they use their private automobile?
That we would also look to the employees or the employers, the agencies, the applicants' policies with respect to reimbursing staff for mileage.
Thank you, Molly. This is about training and systems. Is time spent training employees in the process/systems in use at the vaccine pods included as an eligible expense? And if so, is it subject to the general labor requirements under FEMA, i.e. only overtime for budgeted employees?
Yes and yes.
Thank you.
Definitely overtime only.
So if, just to clarify, if the training of the employee to work in the vaccination pod happened during their straight hours, that's not reimbursable.
Right.
Only the overtime. Okay, thank you.
Yes, yes.
What time span is qualified as a furlough? For instance, laying off Friday, but being recalled Monday to vaccination site eligible.
That's a good question. We would probably look to, if that situation occurred, we'd look to the applicant to support their request to pay for the funding. So we would look at your, procedures as far as, recalling furloughed employees. So I can't answer that. We'd have to really work with the applicant to figure that one out.
Okay, thank you, Molly. What documentation would be needed to provide that the employee was laid off?
Well, I can tell you one that oh gosh, I can't remember. There was one project that we were actually talking about, and there was just different records that the applicant provided to support that the folks were furloughed, and then they came back. They even had budget information to show that this was the cost of those employees' salaries were taken out of their budget. So, we don't have anything specifically written down anywhere that outlines exactly what we would have to receive in that situation. We would just have to work with the applicant to get whatever documentation they have to support that claim. So it would, again, be something that would probably vary by applicant.
Okay, thank you, Molly. It looks like we are at an end of questions for you, Molly. I'll give everyone a few minutes and just do some quick housekeeping. We are getting questions regarding the PowerPoint that will be posted shortly. We hope by Monday afternoon that will be up in PDF form on our website. Any policies that are coming out from FEMA to clarify this policy or to adjust others will also be on our website in real time. We don't have a date for that. I'm getting a question about the reopening policy, Molly, and once that does come out, we of course will post that on our website. We don't have an ETA on that yet. Another housekeeping is, will the responses to this Q&A be documented and made available to applicants? It is our goal to have this recorded presentation posted on our website, and key responses and Q's and A's will be transcribed and added to our FAQ that is already on our website. So the theme here is continue to check the website for updates and information. We keep that up to date in real time. And if there is something that is missing, all applicants have already been assigned a point of contact. Please utilize that point of contact and they can get your answers to your questions and or point you in the right direction on our online presence. Okay, so one last question snuck in, Molly. Thank you for your patience.
No problem.
Is the vaccine project being obligated at $80 a vaccine dose and then being reimbursed at the actual cost?
I should be careful. I'm not exactly, I know, or at least I think we were using $80 a dose at some point to estimate costs. But I also think we might have only been doing that for expedited projects. But regardless, right? So say we used $80 as an estimate. Ultimately, yes, we are only going to reimburse actual costs incurred in accordance with all of our eligibility criteria, and we would be deducting any costs, received through insurance or patient billings as well.
Great, thank you, Molly. Okay, well, that seems to be the last question. I just want to take a moment to genuinely give my sincere thanks to you, Molly, for taking time out of your busy day. We recognize there's a lot going on, not only in headquarters, but in Region 2, and we just really appreciate your continued dedication to New York State and answering our questions and making sure that our applicants have real-time information and the best information so we can continue to best serve fellow New Yorkers. So again, my sincerest thanks. And thank you everyone for taking a Friday afternoon to join us to cover this. And again, everything will be posted by Monday afternoon on the website. Please enjoy your weekend. Thank you.
Thank you.